Hi, everybody. Thanks so much for joining us today for Living with COVID-19, Building the Tech Behind Singapore's Endemic Strategy. Before we dive in, just a quick introduction to who we are. My name is Sarah Espaldon, and I'll be moderating today's session as well as the fireside chat later on. I, as well as all our panelists today, are part of an experimental tech team called Open Government Products. We're responsible for products that you may be familiar with, such as Parking SG, Form SG, and Go.gov.sg. Our mission at Open Government Products is to experiment with the best tech practices from the private sector, exemplify them in our own organization, and propagate the best of these practices to the rest of the public service so that we might accelerate the digitalization of the government. I'm pleased to introduce our panelists today. We have Chiling Chen, who is Deputy Director and in charge of our health tech team at Open Government Products. We also have Sonia, who is Product Manager of Form SG, as well as Endemic, which we'll talk about in a few minutes. And then we have Ki Wei, who is a software engineer who's worked on products such as Postman, Isomer, Check First, and is now in charge of our health tech products at OGP. And so just a quick rundown of how today will go. We'll start with a sharing from our panelists on some of the work that they've been doing. And then we'll go into a fireside chat where I'll ask them some questions about their experiences and the products that they've developed. And then we'll end with a 10-minute audience Q&A. So do add any questions that you have throughout in the Q&A part on Zoom, and we'll try to get to them at the end. And so with that, let's get started. I'll pass it off to Chiling.
Thank you, Sarah. Hi, everyone. It's really nice being here with you. This is actually our second webinar on COVID-19, but quite a lot has, I guess, elapsed like since the last time we did this a few months ago. Thanks very much, Sarah, for the introduction. We are the product team behind some of the tech for Singapore's endemic strategy. And of course, there are multiple tech teams. This is also the work of many operations team across government, primarily Ministry of Health. There are a lot of colleagues who have worked behind the scenes tirelessly over the past many months. But for today, we'll focus a little bit on the tech, but do know that actually, this is a really mammoth effort across many agencies across government. So COVID-19 has really been a roller coaster ride for many of us, and it's gone through many different phases. When our team first came in to help, that was actually in December 2020, sometime eve of Christmas, and we started with a few projects. Prior to Christmas, actually, we started with some mini pilots project on on testing. In the early days of COVID, testing strategy was very critical in making sure that we could detect COVID-19 clusters early. So our team helped to build a ART test registration system that complemented various other registration systems like the SWOT registration system in MOH and Health Promotion Board. We also built some systems for quarantine. And in the early phases of COVID-19 in 2020, a lot of effort was mainly spent on testing and quarantine. For care and recovery, there were a lot of systems and a lot of different operations across hospitals, community care facilities, as well as GPs. We came in sometime around the middle of last year to look at how we could consolidate some of the tech functions that was driving a lot of these care and recovery operations. And of course, last but not least, vaccination rollout program was a keystone thrust of our COVID-19 response, which started way back in December 2020 when our first batch of vaccines landed on our shores. That was around when our vaccine ops team within OGP was activated to help with the national rollout. So fast forward, now we are in February 2022, still very much somewhat in the thick of COVID, but we finally have some time to sort of take a step back to also look at the various systems and processes that we've put in place and to get this time to share with you. One of the things that it serves as a sort of an invisible piece of architecture and infrastructure within government is the COVID-19 management backbone, which is, I would say, up until now, probably not very known to members of the public, but it is the backbone for data storage and data exchange for most of our COVID-19 data across government, which trace together, Health Hub, and more recently Sync actively pulls from, and every day millions of records are being transacted and shared across more than 50 downstream systems supporting many government operations in Singapore. So for today, we will be deep diving into some of our core products that are supporting the COVID-19 response in Singapore, and also looking forward how we are going to improve data sharing within Singapore. One of our main products for COVID-19 was our national appointment system. And if you recall, in December 2020, in the beginning, we didn't quite have an appointment system, and we needed to actually design something very, very quickly within 2 weeks to achieve herd immunity for Singapore. And our project objectives are quite straightforward. All right, one is we want to get people vaccinated very safely. In the beginning, we weren't sure whether there were unknown risks, so we were a lot more careful. We put people through medical triage before they could access vaccines. We wanted to minimize wastage because stockpiles was very limited all around the world. And we had to give priority to those most at risk, primarily healthcare workers and seniors, as well as workers from essential sectors. And finally, at the ground level, we needed to ensure that there's smooth traffic at clinics, and members of the public are not experiencing long queues and lines outside of our GP clinics or at our vaccination centers. The model here is really a model of sort of funneling people into the system in a titration sort of method where we assess what's the demand at a given time, make sure we prioritize people we need to prioritize given the actual supply, and only enable people who meet certain medical eligibility criteria before we enable them to schedule an appointment. So here are some pictures just walking down Murray Lane of us doing some user tests at a community center and the eve of our rollout. I think it was a 2-day user test before we launched soft launched our system to Singapore. These were sort of whiteboard scribbles that was in our office where various team members came together and huddled and worked through step by step what is the citizen journey for to get their vaccination appointments. And the flow we ended up coming up with was as such. Members of the public will hear about it from the news, visit a website, and importantly, fill up a pre-registration form, get notified when they're eligible and when the supply of vaccine. And then they'll fill up a screener and choose 2 dates in a specified time window. So a lot of this operation is powered by what I mentioned earlier, the COVID-19 management backbone. And how this works is, sort of why this is necessary is really because in the beginning of COVID-19, we didn't actually have a central database or system to manage all our COVID-19 data. The situation was evolving very quickly, right? At one point, we only needed test data, and when the vaccines came online, we needed a database to store our vaccine status and to process vaccine records, translate them into statuses that you can then see on your Trace Together and Health Hub apps. So a lot of work sort of goes into making sure that our architecture makes sense and our infrastructure is scalable. Now, for those of you who might be familiar with how some of these systems work, every system consists of these 3 key components. 1 is the user interface, 2 is business logic, and 3, it's a database that stores all your records and data. And of course, because there's so many types of records across the system, we're in a situation of a COVID-19 spaghetti bowl, where you have different systems interacting with each other. Records were not necessarily in sync in the beginning, and there might be lag time, right? For example, a test result that came from a lab system might take a couple of days to reach the test repository, which will in turn take a couple of days to reach the member public. That was in the beginning, but of course, over time, we fine-tuned systems such that they flow almost near real time now. Importantly is how do we ensure synchronicity across all these systems so that when you check into your Trace Together app or go through safe entry, you have the most up-to-date data. Systems are generally quite simple to manage when there are very few components, but adding new components increase the complication very quickly and exponentially. What CMB sought to do was to reduce that complexity by doing two things. One, at point of entry of all this data, we validate them to make sure that the data is clean before we add them into our database. And we apply a consistent set of business logic that translates your vaccine records into vaccination statuses that are consistent for all downstream records to pull. And three, it serves as a central data exchange gateway that is connected and integrated with more than 50 government systems, serving a variety of use cases on the right-hand side here, from pre-events testing to vaccination status for traveling and contact tracing, to vaccination status for display and reduced routine testing and reporting. So as we went along this COVID journey, there were a lot of iterations and changes we needed to make in response to policy. So for example, when the vaccine was finally made available for primary school students or children under the age of 12, we enhanced some of our appointment system to enable them to book their appointments. We also enhanced our COVID-19 management backbone to recognize new status changes and new logic that we needed to make available to members of the public. So for example, people with Sinovac brand vaccines can also get a vaccination status that's valid. At some point, people who got booster shots or didn't get booster shots actually would have their vaccination status expire. These are changes along the way that required fine-tuning and consistent upkeeping of records. So midway through our journey around June, or I think, should I say, October 2020, we saw a surge in cases, especially for the home recovery program. It was an unanticipated surge, of course. Many countries were caught off guard. But that was when technology could come in really helpful in helping to manage a surge in these cases. I'm going to hand over to my colleague, Sonia, who was the product manager for our Endemic system. Little play upon, which is a concatenation of two words, Zendesk and Endemic. Over to you, Sonia.
Thanks, Chiling. Hi, I'm Sonia. I'm product manager at OGP. And I work with MOH on our COVID case system, which as Chiling has explained, is affectionately known as Endemic. So Endemic is all about what happens after you test positive for COVID, right? So generally, the moment you test positive with a verified test, you'll get an SMS with instructions for next steps. Next slide. Yeah, so you'll get an SMS with instructions for next steps. You'll fill out your contact and your health info in a form. This will then in turn trigger an SMS to all your close contacts, and they'll have some free ART kits that they can collect, right? And as for you, you'll be sorted based on your health risk and the health risk of your household members. Most people after this stage will recover at home, and you'll get some free ART kits as well so that you can monitor your test status. For higher risk patients, they have the option to go to a care facility as well. So this is a very, very high level summary of the typical COVID case journey, right? And what's Endemic is the overall system that MOH uses to manage this entire journey for thousands of citizens, of residents, and even travelers to Singapore today, right? So at the heart of Endemic is, as you may have guessed, Zendesk. And you can see a screenshot here of a real patient's journey with updates, such as when they acknowledge that they'll be going to a facility, when they were allocated a specific facility and a specific bed in that facility, and even when they eventually canceled and said, actually, I don't want to go anymore, with a call agent. Endemic also uses a serverless architecture. So for those non-technical folks out there, this means that it's made up of basically a bunch of functions and automations that fire when users complete key events, right? Like for example, if a user uploads a list of fresh COVID cases for today, or if a citizen fills out a form with their public info, with their contact info, their health info, or when a citizen is triaged to a specific recovery facility. So all these actions will trigger automations. And all this is tied together by logging every single update to Zendesk. So that MOH care managers and call center agents can very quickly refer to Zendesk and respond to patients' needs as fast as possible. So in terms of what the ground ops staff actually see and feel, first of all, they mainly use Zendesk's interface, right, to process cases. However, we realized that in many cases, they also need to make bulk updates, and they don't want to update each and every case individually, right? So we added support for bulk updates to Zendesk, where users can just upload a single spreadsheet and all the patient's details will be updated. In terms of the impact on COVID-19 operations, so we started this project in October 2021, just when the cases were about 400 a day. And we've actually helped to scale COVID operations from this 400 daily number to about 18,000 today, right? And we've managed to do this by reducing the turnaround time to public queries by 70%, the processing time for close contacts, for example, by more than 80%. And ultimately, all this automation and expedition of various processes helps operations become more scalable, as we've seen, and empowers the ground ops staff to really focus on care and management of the patient and public issues. So I spoke a little bit about public queries, and we actually also collaborated with MOH on improving the public communications for COVID. And I'll hand over to Kiwei to talk about that.
Thanks, Sonia. So I think apart from solving ops, another key portion of our solution is actually to provide useful communication. And this is really important to help people know what to do when they actually get COVID so that they can reduce anxiety about having to deal with COVID. One problem that we faced initially was that call centers are overwhelmed. Next slide. And the problem with call centers being overwhelmed is that people are calling in with just very basic questions about what to do if they have COVID. And this creates a problem for the people that really have urgent problems when they cannot call in and actually get someone to respond to their urgent requests. Next slide. The solution that we have come about is actually to reuse some of the key products I've built over the years, which is Isomer, Check First, as well as AskGov, to create a whole end-to-end communication solution to help communicate information across. So Isomer is actually a self-help website builder. Check First is a self-service checker builder, and AskGov is kind of like a Quora for government. Next slide. Some of the things that we, previous slide. Yep, some of the things that we wanted to focus on for COVID-19 is actually to be able to speak to users in their own perspective. And this means that we have to break down complicated policies and simplify them for people to understand. So originally, a lot of these policies were written from the perspective of policy writers, but this language is really difficult for the average citizen to understand. And what we did is that we comb through these policies, we find out the key points and only present the key points and simplify this for users to actually read through and find information that they actually require. Next slide. The other part of this is that getting COVID is really a stressful situation. So if you have COVID and you don't know what to expect in the next few days, it creates a lot of anxiety. So one thing that we did on the site was to actually give you a day-by-day play in terms of what happens if you actually get a quarantine order or if you're tested ART positive and symptomatic. So we tell you exactly what happens from day 0 all the way to day 14, what you have to do for each of this day. So that gives you a peace of mind in terms of like the end-to-end journey that you actually face when you actually have COVID. And we made all of these infographics easily shareable across social media. Next slide. Last portion about this is that we know that the site cannot encompass all the possible questions that people have. And that's why we have AskGov as a final catch-all for all possible information that questions that people might want to ask about COVID-19. And this actually allowed us to keep the main site relatively light and just to the key information that people want to find if they actually have COVID. Next slide. So having dealt with the comms portion of it, as we move to the endemic stage, I think another key part of the strategy is to allow people to share their own COVID-19 data, because COVID-19 data is increasingly being used for different parts of your life. It includes like going into malls, being able to dine in. So we wanted to empower people to be able to share their data with respective organizations or even just sharing with their doctors the information they require. So why we built Sync, which is a new product we have just launched last week, is to allow citizens to have full control of their COVID-19 related data. And it's just a single interface that they can log in and manage who they want to share the data with. And maybe they have employers they want to share this information with, or they want to share with different organizations, possibly for entering a single event. This also helps organizations like companies to facilitate compliance with ongoing workplace monitoring protocols. And a new feature that we're going to push out soon is to actually have automated pings to inform organizations when their staff is tested AG or PCR positive, so that they can put in the respective healthcare protocols. Next slide. So how this all works is that first, someone will log in to Sync, and they'll be given an invite link. And after clicking on the invite link, they'll see that like they have to share the information with a particular organization. And logging in with SingPass app, they will see that the different information that they actually have to share. So for instance, vaccination status or test records. After giving consent, they will go back to the dashboard and can see on the dashboard all the organizations they actually shared data with. And next to each organization name, there's actually a small toggle that you can just switch on or off to continue or start sharing data with this organization. So all the control is at the user's fingertips. And lastly, at any point in time, they can click in again to see when consent was given, what exactly are they sharing with different organizations. So next slide. So after we have launched Sync, I think so far we have onboarded over 60 public agencies, 30 healthcare institutions, and since the public launch last week, we have around 350 companies in the private sector signing up for Sync, and we'll be rolling out to these companies as soon as we can. Next slide. And finally, on Sync right now, we have 150,000 Sync users with over 200,000 active subscription. And that wraps up the main part of, I think, our presentation first to give everyone a context about what are the solutions that we can build out for Endemic. And I'll pass on the time back to Sarah, which will bring us the next portion for the fireside chat.
Yeah, thanks so much, Kiwi, and thank you, Sonia Chilling, for sharing. So I think in the next session, we'll transition to the fireside chat and ask you all some questions about your experiences. So I think first question I have for all of you, but maybe we can start with Chilling. What was it like building COVID technology in such a fast-changing and emerging environment? You know, you talked about there are multiple crises, right? You start with vaccine ops and you think, oh, okay, we're done. But then there's, another crisis and then another crisis. So how was that like? And especially how was that like, versus maybe peacetime work, non-pandemic times?
Yeah, thanks, Sarah. It's been, well, exhilarating, a bit of it can be tiring because, sort of the team has had to cycle through so many different phases. And I think it's a common experience, not just for our team, but really many different teams across government and, well, actually really members of public, men on the street. It is exhausting to go through so many different phases without necessarily a very clear end in sight. But it really helped to have a very great team to anchor this project. And I mean this not just from a perspective of OGP, but also the people whom we work with in Ministry of Health. And there were so many agencies with whose officers are really pulling, very long hours trying to make things work. So I think it's really a time when we saw many people step up in their own ways. In terms of building products in a very fast evolving environment, I think one thing that really helped the team in my experience has been to learn how to say yes to the features that are absolutely critical and absolutely impactful for dealing with this crisis. There are many good to haves. There are many things that maybe we feel like it could contribute in a very marginal way to the crisis, but really focus is about having a discipline to crunch it all down into what is most important in a given situation. And that changes every day, or every other month. But having strong alignment with our policymakers has helped greatly.
Yeah, thanks so much, Chilling, for sharing. Sonia, Kiwi, anything you all would like to add?
Maybe we can just add a little bit on in terms of like the engineering perspective of this. So obviously, what's different from building COVID tech is that we have a lot lesser time compared to our usual engineering time to kind of build out the feature. So this means that often rather than like optimizing for technical like excellence, a lot of times you're actually like optimizing for time to impact. So this means that we build out quick prototypes, we build out solutions out there so that we can actually get feedback and figure out whether this works before we clean things up and build it into a more full-scale feature. So I think a lot of this is exemplified in the Endemic flow, in which that we just have a bunch of initial small set of like serverless functions that's dealt with different parts of the workflow. And then eventually we started stitching them together into a broader like end-to-end workflow.
Yeah, thanks, Kiwi. Sonia?
I guess for me, well, like in my regular like days work, I also manage non-COVID products, right? And the difference is very stark. So for non-COVID products, generally we have more time to plan like very far ahead. So my roadmap would be for like even 1 to 1.5 years ahead, right? For COVID products, the situation is changing so rapidly. So you can't even plan at some point, we couldn't even plan 1.5 months ahead. We had to plan like weeks or days ahead, right? And that requires you to be, I guess, very flexible and also try to anticipate the policy changes that will come. If, for example, there's a new, like, more infectious variant, then you'll expect that cases will rise, and then you have to start thinking of all the things you might have to do to support that, right? Whether it's like rate limits or some kind of error handling, automation. Yeah, so I think that those are some of the main differences. Also with COVID products, because of the sheer scale of the problem. As we know, it's a national problem, and it's the top priority of many governments, right? There are many people working on the same problem, which is how to manage COVID. And that's unlike some of our other products, like, for example, PharmSG, which you mentioned. It's a government form manager. While we support operations all across the government, we are the product owners, and so we can make a lot of the decisions quite independently. That's not true of COVID operations, right? Where we have to synchronize very tightly with operations, with policy, and with even communications. Everything has to go out at the same time, and they all have to cohere. So I would say that's some of the main differences.
Thanks for sharing, Sonia. Yeah, and I guess I want to pick up on that point about, multiple stakeholders and coordination. So given, as you said, that COVID is a massive government-wide effort, it's definitely not just OGP, where we're dealing with all these different agencies such as MOH, et cetera. Can you speak to some of the challenges that come with dealing with so many different stakeholders and dealing with this, huge problem that is not only nationwide, but really a global problem, right? Maybe we can start with Sonia and then go to Kiwi and Chiling.
Yeah, so I found that several things helped, actually. So I guess for many agencies, they are at their core operational. So for example, before OGP came in, MOH, COVID operations, was at its core operational and not extremely technical, right? So when OGP came in, we were a new collaborator that added digital capabilities to the equation. And what was very important was actually having a correct command and control structure to influence everything. So what I mean is it was very important for us to have a stakeholder on the MOH side that was responsible for the success of digitalizing this entire project. And I say that because most of the operational leads are in charge of ensuring that, for example, they process these numbers of cases daily. And at the time, because of rising case numbers, even that was a huge challenge. And I'm not sure if many people in the public know, but MOH staff were working day and night. There were day and night shifts, and they had to hand over, and it was a non-stop continuous process, right? So they didn't really have the headspace to also think about the future and how we could scale this and digitalize it. So it was very useful for us to have point people on the MOH side who were specifically responsible for this and could work with all the different ops teams to roll out any feature that we launched. Yeah. So I would say that as a PM, that was very useful for me. Second thing is also many, I guess, people that you work with, I guess if you're trying to do internal innovation, they won't be super technical, right? And so I found that rather it's sometimes not helpful to go too much into the technical details, but rather just communicate to them the trade-offs and keep emphasizing the trade-offs. So if we do this optimization, we won't be able to pursue this major feature, and the launch of this feature will be delayed by 5 days, and always tie that back to the end impact on citizens, right? Which means that, okay, if cases rise to 10,000, we might not be able to support that. And, SMSs might be delayed by X number of hours. Yeah.
Yeah, thanks, Sonia. Yeah, Kiwi, can you share a little bit as well? So you mentioned, working specifically on COVID.gov.sg in terms of the COVID comms in the past few months. Can you share what it's like working with multiple stakeholders?
Yeah, so I think one thing to realize is that the government is huge and there's many different stakeholders that are in charge of different parts of this. So I think one of the main things that we wanted to do for comm strategy was firstly just to get everyone into the same room so that everyone can kind of just sync up in terms of like what is the actual ground ops, what are people giving feedback about, so they can kind of just tighten the entire feedback loop for policy as well as operations and communication. So I think that was one thing that we tried very explicitly to do at the start. It was not easy because the organization was huge. We need to find the right people to bring them into the room so that like they can get the right information, have the right discussion, and then push that information out. But I think once we got the right people in the room, I think this helped to kind of make our communications a lot clearer because we can ensure that every time when you push out new policy change from the policy writers, comms get updated, as well as operations people on the ground where they're answering phone calls, they are kept up to date with the latest information and ensure that people get timely and correct information that's aligned throughout the entire government. So I think that's one of the main takeaways that I actually have in terms of like working across like multiple stakeholders and coordination for like COVID response.
Thanks, QA. Yeah, Chiling, anything else you'd like to add?
Yeah, well, I think Sonia and QA has covered a lot, but maybe I'll just add one thing, which is about putting the citizen experience front and center in a lot of our communications and interactions with agencies. Because when you have a lot of stakeholders, I think it's easy for us to be optimizing on individual stakeholders, either interests or perspectives, right? But ultimately what matters is implementation, and what matters is how the citizens experience all the planning we do, right, and all the systems we build. And that experience, if we put it front and center, it helps to really keep us anchored on what is important at a given time. Give you a very concrete example, some of our product designers actually sat right next to the hotline staff in order to come up with the covid.gov.sg website that you see. And that's because sometimes that can be just because things are moving so quickly, there can be these things between what the hotline staff tells a member of public and maybe what's the intended policy, right? Information takes time to travel, so it's natural for this to happen. But how do we make sure that at least the information we push out via covid.gov.sg is consistent with what the hotline staff is saying and is consistent ultimately with our policy? And if there are desyncs, in a way, OGP sort of serves as a sounding board or feedback channel, right, back to the policymakers to say, okay, here's what we observe as desyncs with the comms channels right now. Shall we work together to fix that? So there are a lot of instances of this kind of tightening of feedback loops that needs to happen when many stakeholders are in the picture. And I think we've been blessed to have teams that are very receptive across various ministries and able to make some of these changes on the fly fairly quickly.
Thanks, Chiling. Yeah, so I want to go to the next question, which is, about how we were able to build something so quickly that worked so well, right? Because you're in this emergency situation, you need to build something that can serve the whole country, 5 billion people. Can you share some of the lessons in terms of how you were able to build fast? And I'll direct this question first to QA if you can share.
Yeah, so I think one of the main strategy that we've used is to just reuse some of existing products that we already have. So I think the product strategy that OGP all along has is that we want to build composable products that can be put together to solve a huge range of problems, right? Because our hypothesis is that 90% of government's problem can be solved with a base set of solutions that when put together in different ways, will just achieve the outcome that they want without having to build customized solution for each of this individual problem. So I think COVID.gov.sg is an example of how we put this product strategy into play. So for instance, for COVID.gov.sg, we needed a site to be built quickly. So rather than going to build a site from scratch, we reuse one of the existing product, which is Isomer. So this allowed the MOH policy officers that have no technical background to go in with an easy to use CMS to just update information as and when they require. And to kind of bolster Isomer, we also brought in Askaf as well as Checkfirst to first allow people to answer questions on the Quora-like platform, and then next also Checkfirst as just a way to easily kind of redirect people to different places that they need in the site itself. The other part of this is so that to build quickly, we have to really just focus on the parts that provided impact as soon as possible. So this means that we have to really hone down what our initial MVP is and just focus on those places. Rather than trying to build like a huge mammoth system initially, we look at key parts that will give us the highest impact and then start building from that first side. And then after I think about integrating them after we have additional room to think about this. Yeah, so I think having this like composite products as well as like focusing on time to impact, I think this is what we looked at to quickly build something that worked well.
Thanks, QA. Sonia, do you have anything to add?
Yeah, I guess from the ops user perspective, one thing that we focused a lot on was using things that users were already familiar with. So one thing that we had to introduce in the first place was a case management system, right? That was inevitable because one key problem when we came in was that ops users didn't have a common interface to view the entire patient journey. So definitely they would have needed to learn a CMS, and that was, I think we wanted to keep it at that. Like, let's not make them learn too many things because the ops users are very busy and not all of them are highly technical, right? So what we did was we tried to preserve ops users working on Excel as much as possible for bulk operations. For example, if they are trying to scrub contact numbers for many people at once, that's an operation that's better done on Excel rather than individually case by case basis, right? And we also, we tried as far as possible to integrate with tools that they were already familiar with. So like the bulk upload that I spoke about previously, how that works is users just use their spreadsheets and they email it to a specific email, and we do all the post-processing of the data. So all those tools are things that users are already familiar with, and it made it much easier to get off the ground, without a hitch. Of course, there were hitches, but yeah, we want to reduce them as much as possible. Another thing that we did was also, if you guys saw, the whole COVID case journey is like a 9, 10, or like 12-step process, right? And it's also very conditional. So you could have gone to like 10 different routes, and for those 10 different routes, there are different journeys, right? So one thing that we did was, like Kiwi mentioned, we really focused on automating the highest impact areas first, and there was no way that we could have replace the entire system at once. There's no way we could have done everything at once. So we had to do things piecemeal and make sure that the inputs and the outputs of that part that we automated or replaced are exactly the same to minimize disruption. So we're replacing the system. We were replacing manual processes like one piece at a time. You can think about it that way. Yeah.
Thanks, Sonia. So next question I have, and I'll direct this one to QA. So you talked about COVID.gov.sg, right, which was an initiative to improve public communications about COVID. But it seems a bit kind of random, right? OGP is a tech team. Why are we working on public communications? Can you speak a little bit more about that and how we got involved?
Yeah, so I think this is an interesting question, right? Because by discipline, I'm actually a software engineer, but like while building out COVID.gov.sg, I actually spend most of my time just figuring out, how do we better present information to citizens so they can understand different policies. And I think this goes back to the root of what OGP stands for and how do we approach problem. So I think first and foremost, we are a problem-solving team. Like, we're not a solution-building team. So we're not here to kind of like build different tech products. We're not here to build different platforms. We're here to solve problems. And I think that's very core to what OGP does. And in this particular instance, we know that even if we have the best, a beautiful website, we have like different Ask platforms as well, checklist platforms, like without actually tackling the content of the information they're putting on the site, none of this will actually be useful. So I think that's why we didn't stop at just putting out the website and putting out the different solutions we have. We actually went on to talk to people, both from the call centers as well as the policy writers, to kind of just bring together this gap and close this gap so that people actually understand what's happening. So yeah, I think that's just really core to what OGP does, which is just really looking to solve the problem end to end, not just building like tech products.
Yeah, no, I think that's a great point. And I mean, I think that's very essential, right, to the foundation of OGP that, we're doing a lot of things. We're trying to improve tech in government, but that doesn't necessarily mean that everything has to be just code, right? Experimenting different ways to manage people and to create this very innovative organization within the government. But yeah, thanks for sharing, Kiwei. The next question I have is for Chiling. So there's lots of news reports recently about civil service and how there's record turnover and record attrition, especially in the past few months with COVID. Can you talk about that in particular with the COVID team? How has that been?
Yeah, I think it's a huge challenge for a lot of agencies. It's record high for 10 years. I think that's what I read in the news. It is a difficult mission, and being in the trenches for 2 years, it is natural for people to experience burnout. Even on our team, there were very difficult times, and there were also people who had to roll off the project in different junctures because it was becoming too intense. We were pulling hours that were not sustainable. And I think it's a common experience, not just for OGP and really for many agencies. We try to handle this by really refactoring how the team works, mainly putting in place sensible on-call schedules, trying to deprecate certain systems that may no longer be in use, so that we reduce the overall complexity of our systems for our team as well. Making sure that people get enough rest and that they're taking their leave, and just looking out for each other, I think on a very day-to-day basis and level has really helped to keep the team together. I must confess 100% that it has not been easy. And the engineers, product designers, and product managers who are on the team have firsthand experience of what it's like to be working on a high momentum kind of project like COVID Ops. But I think we learned a lot in this whole experience, that actually we might keep some of these practices, the good parts of it, right? Not so much the less sustainable parts. We learned, for example, how important a good on-call schedule could be for team mental health and team well-being. And we now have people sort of nagging each other to take leave. Yeah, so I think there are good things that came out of COVID in terms of team practices that we would like to retain over time. Yeah, for the rest of public service, I think the experience varies across, and the underlying issues might be different from agency to agency. But what we hope to do is really to experiment together and alongside with other agencies and see what works better for future public service. One of the things that OGP does, apart from building products, is propagation. And when it comes to propagation, it means, how do we do performance appraisal? How do we work from home? What are some of the practices that can help with team health? And we'll continue sharing some of this and also learning from other agencies that we work with. Yeah.
Thanks, Chiling. Next question is about data privacy. So this is another hot topic recently, right? Since there's been a lot of public debate about data privacy, especially with regards to COVID apps and processes that are taking in a lot of public data. Can you comment on how citizen privacy can be protected? I'll start with Kiwei.
Yeah, so I think our approach to data privacy is kind of central to how we end up building Sync. I think the best way to kind of really approach data privacy is to first allow it to be transparent who you're sharing data with. So I think through Sync, you can easily see through one glance who have access to your data. And I think the second part is just putting the control right in the citizen's hand, right? So rather than having to kind of like go through a complicated flow to get consent and all the stuff on Sync itself, it is literally just one toggle next to the organization name that you can click to do stop sharing or continue sharing data with people. So I think allowing people to know who they're sharing with, what they're sharing with, and having control over when you want to start and stop sharing. I think that's our key insight, I guess, into ensuring data privacy for COVID apps, as well as like collection of like data.
Thanks, Kiwei. Chiling, Sanya, anything to add on this? Okay, so I realize we're almost out of time for our fireside chat. So I'll move to the next question, which is a question that was also, I think, asked in our Q&A, but can you share some of the learnings about this entire process? It's been almost, or I guess over 2 years now since COVID has started. Are there any things that you would do differently? Maybe takeaways, learnings that you would apply to your next projects? Starting with Sonia.
Yeah, the moment I saw this question, I went to open up our Endemic retro that we did recently, just in time. So I think one thing that we definitely would have done earlier in hindsight was do more documentation, because how Endemic works is, again, it's so conditional depending on where you are sorted. There are different actions, and then there's just a lot of branching logic. So what we wish we had done earlier was actually produce more documentation, just simply that, so that we could actually track the effects of new features that we added in later. I think the reason why we didn't do this was because, well, at the start, we were just really rushing to get automations in so that we could alleviate the ops staff, right? And that was our highest priority, just building. And secondly, also because we didn't anticipate that it would get so complicated with all the policy changes over time. So that's definitely one thing that, I would have done better in hindsight. Yeah, would have prioritized that more. Another big thing that we learned was basically, actually, even though Endemic was one big project, we actually had 2 teams working on it. One team for COVID cases and one team for close contacts. So one of our learnings was that we had to be very careful about shared resources. And when I say it now, it seems obvious, but what I mean is that Zendesk's API basically has API limits, right? And these API limits were shared among the COVID case team and the close contacts team. But these 2 teams were working pretty independently of each other because the workflows were so different. But that was one area on which we could have coordinated better, right? Obviously, because the contacts tend to be like 4 contacts for every COVID case, their number scaled a lot faster. And in many cases, we affected each other's operations because we were consuming more of the limits than than were allowed. Yeah. So better coordination between engineering teams. Yeah.
Thanks, Sonia. Chilling.
Yeah, actually building on what Sonia mentioned, we did have, I think, at some point 3 teams working on 2 to 3 teams at different junctures, right? It helped a lot to be loosely coupled, but highly aligned, right? Loosely coupled because that's how we move fast. If all 3 teams had to sync up on every decision, that would take many days to just get something moving, right? And we'll have a lot of meetings. Actually, that's one thing I did feel that when we try to coordinate and align, meetings are not always the most effective and productive way to go about it. Highly aligned could come in the form of actually like 5-minute syncs or just stand-ups in a given day, or just keeping each other informed about context and changes along the way. So loosely coupled, highly aligned was something that really helped us move fast during COVID. I think the other thing I learned was also to balance between open-ended ownership for solving a problem, like what QA mentioned, right? We're here to solve problems, not just to build the tech, but also respecting prerogatives of other teams that do have their own priorities, do have to keep some of the systems running or have their own ways of thinking about things. How do we find common ground with teams who may be coming from a different place? I think it's something that as a whole team in OGP, we learned a lot about during COVID. Yeah.
Thanks, Chilling. And then last QA.
Yeah, so I think one thing that we could probably do differently, like if we go into this again, I think is to from the very start be more conscious about the way that workload is being distributed across all the different engineers, as well as product designers, product managers, as well as like policy people. Because I think in an emergency situation, it's easy to forget that like there is a limit to the amount of productivity you can actually get out of someone in a given day. So I think and the list of tasks is never ending to continue building. But I think it's necessary for us to kind of slow down and be more conscious about this so that we can actually allow people to always operate at the maximum level of productivity that they can comfortably do. So this means things like ensuring that on-call is sustainable, ensuring that people are not constantly like ping for random stuff, and we kind of batch up some of these requests and deal with them at one go, right? So they allow the engineers sufficient time to rest, as well as like allow them to build the best thing that they can actually build. But I think another thing that I took away from working on, I guess, the COVID-related products is that the sense of mission is really important when we're trying to build a product, because I think everyone went into this effort knowing that the things that we're doing have an immediate impact to the entire Singapore people that are getting COVID, and these are people that really needed help. And I think this sense of mission really helped us to align and as well as figure out what is the next thing to build, right? What is the most impactful thing that we can actually do? So I think always keeping this sense of mission in the team that we actually have will allow us to build good products. Yeah.
Thanks, QA. And yeah, I realize we don't have very much time, so I'm going to go to some of the questions that have been asked by the audience. So there's one question, actually a combination of two questions. Just first question is, are there certain aspects of the solution that you had to compromise on? How did you manage that? And were there any ideas that didn't work that you had to roll back on? Maybe I'll start with Sonia.
Yeah, I might need to think about this for a while, but broadly, of course, we had to make many compromises, but I would say not unwillingly. So there were many optimizations that we were not able to do. So I can even tell you now that today, not 100% of COVID cases are on Zendesk. They're not. And the reason is because for some categories of patients, they're so small, and they're bottlenecked by other things. So there was no point putting in all this effort to onboard this particular route that takes as long as any other route to onboard, right, onto the system. But I would say it was a very willing compromise, because it was so clear that there were other areas that would be much more impactful. For example, for very high risk patients, right? That's something that we really focus on and wanted to expedite as much as possible, because they're the ones that really do need help and where speed really matters. So I would say we were happy to make those compromises, and in fact we prioritized quite ruthlessly when it came to COVID. Yeah. The second area, I also wouldn't say it was a compromise, but there were definitely conversations and a lot of negotiation that went on between the tech and the operations side of the house and the medical side of the house. So the reason I say this is because from the medical perspective, obviously you want to provide as much, you want to cater for as detailed and personalized care as possible, right? That's the best care outcome for the patient. So you want many different permutations. You want very, very personalized care. However, from the tech and ops perspective, we can't afford to provide that personalized management for every patient, because that means that we'll have to sacrifice for other patients, right? So we needed to do a lot of negotiation and a lot of mutual understanding of each other's concerns in order to arrive at a plan that achieved the best balance for everyone, and prioritize the people, again, that needed help the most. So that's what I would say on compromises.
Thanks, Sonia. Another question that was asked is, does the team use Scrum Methodology or OGP-owned methodology? Maybe Chilling, you can share a little bit more about how the team approaches problem solving.
Yeah, interesting question, because I think we haven't really put a name to it. We don't really call what we do Scrum or even Agile, actually. This is actually a good idea. Maybe we should put a name to it at some point to help with propagation. But if I had to describe it, I think it's about keeping product teams really small, comprising of functional experts, let's say software engineers, product designers, PMs, or product operations, or policy people, and just get to the bare minimum team size, right? Keep the team really small so that the communication and coordination overheads doesn't become unwieldy. And in terms of our methodology, well, actually, prioritizing ruthlessly is probably one of our philosophy. So at any given time on a GitHub tracker, you will not find more than 2 or 3 priority 1 items. You'll find a lot of priority 2 and 3 items, but at any given time to just focus on the 1 or 2 things that's most impactful, help to channel everybody's energy into getting that done. And I guess the third thing that characterizes how we work at OGP is to not be afraid of challenging ourselves internally and be proven wrong. And these challenges can come internally and externally. It can be from user feedback, right? So every piece of ticket or user feedback that comes through our way is channeled through a product operations person who then provides these feedback to a product manager. And we take these feedback actually very seriously. And when there are a lot of our, sometimes even incidents, right, or impetus for having an enhancement on the system came from user feedback. So having that feedback loop and taking that feedback loop seriously is important. Sometimes what we think works well for users may not actually pan out that way. So being able to be proven wrong by users is also, I think, one thing OGP takes seriously. Yeah, so I would just sort of characterize it in those 3 points. Don't know if Kiwi or Sonia has anything to add.
Thanks, Chilling. Yeah, so I'll go to the next question since we don't have very much time left. Quick question for Kiwi. How does Check First figure into the COVID pandemic strategy?
Yeah, so I'm thinking Check First, if you go to like the last tab, which is like, if you're not sure which of the category you actually fall into, I think that's where Check First comes in. So just by answering a couple of questions, we redirect you to the specific parts of the site that is useful for your particular situation. So we realize that some people might not want to kind of read through all the different descriptions for different categories. They just want to answer some questions and get the results that they should go to. And I think Check First was a good fit for this particular use case.
Thanks, QA. And then a question for Sonia. What is it like being a PM at OGP? How is it different from working as a PM in another industry?
Yeah, so being a PM at OGP, there's more focus on internal innovation within large company dynamics because government is massive, right? 140,000 public servants. There's more focus on impact and being able to define that very broadly or in even like strategic impact, like not immediate impact in terms of a certain metric. And yeah, less focus on like quarterly revenue figures, for example, or one kind of specific metric like users. For example, like users is not really a very useful metric for us actually, because it's more about the public impact, right, of your use case. You could have one user, like actually MOH is just one user for us, but the impact of COVID projects are very, very big, very high. Even for PMs in industry, I feel like you can't generalize them because it depends whether or not you're working at a big established company and product versus like a very early stage startup. So I don't think it's easy to generalize even within PMs in industry, but definitely the key thing is that they would focus more on revenue lah. Yeah.
Thanks, Sonia. And yeah, unfortunately, I think that's all the questions that we have time for. I know there are more questions in the chat. If you are interested, do reach out to us. You can reach us at hello@open.gov.sg, and we're happy to answer any further questions you have. Also, a quick plug, given that the last question was about being a PM at OGP, we are hiring. So do reach out. We're hiring across the board for product managers, engineers, designers, also on our corporate team. So do reach out if you're interested in joining our team. And once again, thank you so much to our panelists, Chilling, Sonia, Kiwi, for joining us today and sharing your experiences. Thank you to all our attendees. I hope you found this fruitful and learned something new. And yeah, everyone have a great Friday and talk to you all soon. Bye-bye.